Hi everyone. We wanted to do a video today to talk to you guys about this elimination absorption layer of our pyramid. Hello, I'm Dr. Brandon Bupp, owner at Advanced Health Wellness Center, and
I'm Leah Klein, the physician assistant at Advanced Health Wellness Center.
Leah does a lot of our blood work evaluations and discusses nutrition things with our patients. And so we wanted to talk today about what things can we do to help with this elimination and absorption kind of sequence system. And so really that has to do with our stomach, our ability to break down food, our small intestine, large intestine, to further break down food and absorb it. It even actually starts with our teeth and our making the appropriate saliva and enzymes coming from our mouth. But that's the breaking down and absorbing. And then there's an elimination process that again involves some of those same systems or structures. And also adding into that things like the liver, kidneys, gallbladder. Guys, this system is actually very, very important, very, very active, is under a lot of stress because one, we're digesting and trying to absorb and eliminate things every day. We have to do that in order for our body to work. But we're also exposed to and eating a lot of things as Americans that are very strenuous for the body to absorb and then eliminate. And so the first thing that I want to talk about here is stress. And so you guys know, you've heard me say this lots of times, at least 4 times now in a row, in that we're looking at balance between the autonomic nervous system and sorry, not the autonomic, the sympathetic nervous system and parasympathetic nervous system. Those are both components of our autonomic nervous system. And so when we're in stress mode, when we're in fight or flight mode, we don't digest, we don't absorb. Leah, this is a really common thing that we see in our office. You want to talk about that a little bit?
Mm-hmm. Yeah, when your body's under stress, and it doesn't have to be emotional stress like you feel stressed out. It could be biomechanical stress, which is usually something structural. It could be a toxic stressor, so the foods that Dr. Bupp just mentioned that are treated and processed, that stuff is toxic to our system. It's not supposed to be eaten. So those things are stressful to the system. Exposures maybe to heavy metals or molds or things like that are a stressor. So anyway, the body doesn't know the difference between you're being chased by a bear in the woods or that you're just digesting something that you're not supposed to be digesting. So the way that it responds is to survive, which is not to digest your food. It wants to keep you fed as long as you possibly can. So it won't create strong enough stomach acid. It won't move things along the way that it's supposed to. So you'll get constipation, bloating, heartburn, that kind of thing. So those are all stress response, and normal stress response. The body thinks that you're under stress.
Right, and so we don't make as much hydrochloric acid. We already talked about that. Mm-hmm. Digestive enzymes, that could be a problem. Obviously, we're not eliminating things. So this is a big one. People think of emotional stress, but the other thing is sleeping. If we're not getting enough sleep, mm-hmm. our pineal gland doesn't produce enough melatonin. All of those things, guys. And Leah, what's the best way to know if you're making enough melatonin?
Get it tested.
Test it, right? Same thing with cortisol. Are we overdoing cortisol? Are we underdoing? Mm-hmm. Since we've been doing those cortisol tests and testing some of those other hormones, pretty interesting results, right?
Yeah, definitely. Mm-hmm. It's a saliva test, so we get to see what your cortisol does throughout the whole day rather than just at one point in time if you were to do it via blood draw.
Out of 10, how many of those are normal?
I haven't had a normal one yet.
So it's very rare to have normal, these stress hormone levels to be normal. So again, that then correlates to people get gassiness, bloating. I think that's a huge component to digestive issues in our ability to absorb nutrients, but also eliminate waste. And you should be eliminating waste every day, meaning you should have a bowel movement every single day. Okay, so let's move on. So we're also talking about things that we should be eating versus things that we shouldn't be eating. So I'll go through some of the things that we should be eating. So depending on what medical professional you're talking to, there's certain diets that will eliminate some of the things that are actually really healthy for us to be eating. So for us, this is, again, a general idea, general concept. It's not prescribed nutrition based on the individual necessarily, but we want things that are high in nutrient density. So what they call phytonutrients, things that are high in prebiotics and also probiotics. So those foods, you can actually Google prebiotic foods, probiotic foods. I would recommend doing that so you can see a list of different things that are in there. Phytonutrients are going to be things that have like nice colors. Peppers, you think of like having a colorful plate of food. We know that green leafy vegetables contain the most vitamins and minerals really of any food that we can be eating. So we want to be getting these nutrient dense, especially, like I said, green leafy vegetables, cruciferous vegetables, but also on the probiotic side, then there's different fermented foods. So the sauerkrauts and kombuchas and pickled things like pickles, pickles and different like pickled eggs. Those are all of those things are actually very good. They really help our gut. I know some people that will do a scoop of sauerkraut every day. It's actually a really good idea and a really great way. It's better to get, you guys have all heard of probiotics. It's better to get probiotics from your food than it is that are naturally occurring. They're going to be much more diverse than probiotics that are just in a capsule. There's only a few strains in those things, and they're again not naturally occurring. So those are some of the things that you should eat. You guys, a lot of you, we already know about what those things are. It doesn't change. The things that we tell you to eat are good for your diet. One other thing, we talk about your microbiome. So prebiotics are good to help your microbiome. We have 100 trillion different, 100 trillion bacteria in our body, most of which found in the gut. So when we look at blood work, I mean, what's the main thing we're talking about with people when we go through their blood work?
Gut health.
It's almost always what's happening with their gut, right?
Yeah.
So that's a really important component of this. So then the last thing was the not that. So what things should we not be eating?
We should not be eating foods that are processed or full of preservatives. So your boxes, your cans, any meals that are made and then frozen that you would just heat up to eat, all that stuff is full of things that we should not be digesting. But sugar is a big one, dairy is a big one, gluten is a big one. These are inflammatory foods. So we try to limit or completely eliminate those foods in order for your gut to work better.
Sorry, there was just a saw going off.
Some construction going on.
There's construction. We weren't expecting that to happen. So the next thing would be fasting. So why, Leah, is fasting a good idea?
Yeah, intermittent fasting is really important for your body to kind of have a chance to reset. So you'll make more healthy cells while your body's fasting. Also, starving the sugar is important too.
Yeah. So Dr. Jason Fung, F-U-N-G, he's a medical doctor, has a really good book. He kind of wrote the book on fasting. We have that here if you guys would like to borrow it, or you can just look it up and check out some of that information. Again, fasting gives us a chance, gives our digestive system a break, is really one of the great ways of looking at that. Mm-hmm. It allows kind of our system to catch up. And then the body actually goes into a repair cycle because it's not constantly digesting. It can actually start working on some repairing. And again, our toxins are stored in our fat cells. And so we got to do something to try to get those toxins out of the fat. If your body starts using the fat for energy, it can be a reset. Again, intermittent fasting is a really good idea. A lot of times people will fast 1 or 2 days a week, interspersed throughout the day. There's a lot of research that shows eating only for an 8 to 10 hour period of time during the day is actually a better way of doing things than eating, all around the clock.
And it's not one size fits all either. So your body might respond to a 16-hour fast better than it did a 14 or 24-hour fast. It's something you'd probably have to kind of play with and figure out what works best for you, but it's definitely got benefits.
I like it when you add some of those helpful tidbits into the conversation. So then also we look at the technology that we use. So again, if you have questions on this fasting, please let us know. We do a detox with it, which is a really, really good idea for many, many people to be doing. It is personalized. We try to make it, we try to understand what's going on with the person, but it's detox fasting, 3 to 5 day period is actually a really good idea. People notice that they lose a lot of water weight, a lot of bloating, just an overall reset. Energy, a lot of times when we're not eating, strangely enough, energy goes up,
Better, yeah.
right? So the technology that we use. Again, we've talked about this, the microcurrent, there are specific settings that are very, very beneficial. Microcurrent, again, is frequency specific microcurrent. It's using frequencies to communicate with our cells and kind of support the normal functions and pathways of those cells. The detox pathway. So a short story on the technology. When we first started using it, we weren't sure. Like, it's not something you immediately feel. We weren't sure if whether it was working or not. And this one patient who had some toxicity issues, we knew that, had some inflammation issues, needed to detox. We would do other settings on the microcurrent and she would be fine. Every time we did the liver tox setting, which we didn't actually know this right at first, every time we did the liver tox setting, she would throw up, like within hours of doing it. And finally we figured out that it was like every time she was doing this liver tox, she was throwing up, and it was because that was her body's way of detoxing. It was really stimulating, it was overly stimulating this detox pathway. So we had to change it up a little bit and calm it down. But knowing that, number one, we knew it was working. Number two, we knew that she really needed to do it. Mm-hmm. So the technology is a really good component of that. We're happy to explain that more. Vitamins and supplements. So again, if we want to look through that, Leah, if you want to talk, so there's several different vitamins and supplements that we use in our practice from a gut health and from an elimination absorption standpoint. Of course, there's probiotics, so everybody's aware of probiotics. We have two, like, there are the king for us, and we recommend it almost to every patient that we take care of. Because almost everybody needs help. The first one, the Regulat, is helping to break things down. Almost everybody needs that. You want to talk about it a little bit?
Yeah, Regulat. So this is not only great for breaking down your food, but it's also immune system supportive. So your immune system is primarily housed inside your gut. So if you have an unhealthy gut, likely you have an unhealthy immune system. So we like this from both those standpoints. But what it is fermented herbs and vegetables, basically, and so it's already going to help from the salivary standpoint, where Dr. Bupp said your digestion starts in your mouth, so it's going to start there. It's fermented, so it tastes vinegary, but it gets all the juices flowing to get you to digest your food better. It helps you produce stronger stomach acid, helps break down the food because fermentation and digestive enzymes help break down your food, and so it helps with the digestive process, but then obviously it strengthens your immune system also.
Because of that. So they have a really, really cool website. It's USA or Regulat, R-U-G, here. R-U-G-L-A-T. R-A-G-U, see it? L-A-T -USA.com. That's awesome stuff there. And then the other one, man?
Ion Biome. So this is also a liquid. These are both liquids. I don't know if I mentioned that, but this one's flavorless. It's a mineral blend that strengthens your gut. So if you've heard of nutrients leaking out, or you feel like you're not absorbing what you should, this helps to strengthen the lining of your gut. So this is really good too. Again, related to the immune system, because your gut. Healthy gut leads to a healthy immune system. So this is good for gut strengthening.
A lot of times people take probiotics, but is that a probiotic?
This is not a probiotic.
What
No.
is-
This is a mineral blend. This is supposed to strengthen the gut lining, not add any bacteria, not add any enzymes. It's just strengthening, making you have a stronger gut lining,
in a better environment.
a better
right?
digestive environment. Yeah.
So that a lot of times people will do probiotics, but they don't survive because
Yeah.
the gut is too acidic. The gut should not be acidic. The stomach should be acidic, right?
Mhm.
So then what else do you got over there?
I got amino acids, perfect amino acid powder. So amino acids are really important, not only for digestion, it helps with muscle recovery and that kind of thing too, but it helps with energy, digestion. This tastes like berries. It's good, easy powder to take. Great, it comes in our multivitamin pack that it looks like we'll be talking about in a second too. There's amino acids are important for every body process because your body uses them for energy.
Well, and use them for energy, but a big part of that is repair. So helping to repair the gut lining, so that's the minerals that are kind of supporting that process. That's actually the building blocks for repair. So we have to repair ligaments, tendons, we have to repair our gut tissues. So very helpful in that regard.
Collagen's one of those that's really good for everybody to be taking too. So it helps with digestion, helps strengthen the gut again. This one has 5 different types of collagen in it, so it's probably better than most other options. Collagen decreases inflammation, helps your body decrease inflammation. Guts that are inflamed don't function well, so it helps from an inflammatory standpoint, helps joint inflammation, hair, skin, and nail benefits. Good stuff.
Amber loves her collagen. And then lastly, we have the Vitalio. Good. Vitalio men's and women's wellness pack. So they're kind of separate, but really this is all of the vitamin A, vitamin C, vitamin D, vitamin E, vitamin K. So these antioxidants that the body needs, essential antioxidants, which means we have to get them from someplace. There's methylated B vitamins in here. There's digestive enzymes in here. There's actually a probiotic blend in here. So this multivitamin is awesome. It is not cheap because it is made from, we actually know the people that make these, and they're made with the highest quality ingredients they possibly can be made
Plus
from.
it's like 4 things in one.
And it saves you money because you're yes. So a lot of people are taking zinc and then taking selenium separately, and then taking a digestive enzyme, and then also taking when we were testing CoQ10, how many people had bad results on that?
Most.
Pretty much, it was like
Not maybe
90.
everybody.
Yeah, it was like 98% of people were low on CoQ10, which is necessary for your body to make energy. Really important for your heart. So anyways, this one is a big favorite. This is not specific to digestive function like the other ones that we have are. But again, if you're lacking the minerals or the vitamins, then you're not going to be able to, your digestive system isn't able to repair and heal. So that's our elimination and absorption lecture. If you have any questions about that, we'd love to talk with you. So Leah, there's testing that we can do that helps to look at what's going on with the gut. You want to talk about that a little bit?
Yeah, we typically do a blood work panel that can check anything from your digestive function to the amount of inflammation in your body to your immune system strength. Obviously, that's all related. We've already mentioned it. Liver and kidney function, all of it comes in our one functional medicine blood panel. So,
how well people are breaking things down.
Yeah, how well you're breaking down your food, and then how much of it's being absorbed. It tells us a little bit about that. Tells us a little bit about the strength of your stomach acid, so we can kind of customize more of a plan based off of what your testing would show.
Potential toxicities.
Yeah.
There's some other specialized testing too that can be helpful. So one is like our food sensitivity test, but people have food sensitivities because they have absorption and elimination issues, right?
Yeah.
So we can do that. Again, that's an important thing to take this irritating stimulus out of our environment. But there's other specialized testings too. There's stool tests, and they can look for parasites. You can look for parasites. You can look for yeast. Yeast is overgrowth is the big one. We don't want to feed them with certain foods, right?
Mm-hmm. Yeah, sugar looks at bacteria overgrowth. So if you have some kind of bacteria that's kind of overgrowing the gut, stool test would show that.
Cool. So guys, we know this is a big issue for a lot of people. We want to be available to help. If you have any questions, please let us know. Of course, we always offer to do a free evaluation consultation. Leah has a system that she can do that as a telehealth visit, so a person doesn't even actually have to come to our practice. But again, we want to be able to help and make a difference. So if you have any questions, please let us know. Share this with somebody that needs to see it, and make it a great day.